Hello, everyone. How are you doing? Thank you for joining the OBHealthy Doctors Lounge. Hey, we're starting just a little late because I've had some technical difficulties this morning, and but we fought through them and we got it open. I'm not that tech savvy, but we got through them and we opened up, and I'm glad that each and every one of you are here this morning. All right, so let's just step back for a second. We're a group of Black physicians, and we're here for two reasons. Number one, to improve the health of people of African descent. And number two, to encourage Black males to go into medicine. You know, the thing of it is that there are so many, I should say, Black males going into college, but they're just not choosing medicine. We want to excite the Black males that they can do it, it's possible, that we need them in these positions so that when I get old, I'm not old yet. When I get old, I want somebody that looks like me to take care of me. So come on, brothers, let's do this thing. All right. I just want to say, and I'm sure those who've tuned in, that this webinar is every second Saturday. Well, put it this way, it is most second Saturdays. I'm telling everybody right now that for July and August, the Doctors Lounge will be on vacation. These doctors need a break. So July and August, we're going to take off and we will see you in September. So tell everybody that we are taking off for summer vacation. All right. If you want to see our prior webinars, all you have to do is go to OB Healthy and hit the YouTube sign. All right. And all of our prior webinars come up. All the topics, all you have to do is listen to them. It's so much medical information there. All right. Remember, when you do open the YouTube, please subscribe so we can continue to bring the YouTube videos to you. All right. I want you to sit back, but also I want you to type in your medical question. There is no question too small or too large. All right. We just will answer them to the best of our ability. I'd like to thank OB Healthy for allowing us to bring this to you because without them, we couldn't do that. But the most important thing I can say throughout this whole webinar is that please do not change any aspect of your medical care until you discuss it with your physician. Only your doctor truly can best take care of you from a medical standpoint, I should say. All right, I think I've said everything that I needed to say. Um, this this month we have holistic medicine, preventive medicine, and we have somebody that I've known. Oh boy, we actually went to medical school together. So that's how long I've known this brother. So and he's just a gem of knowledge when you start talking about natural medicine, holistic medicine, preventive medicine. So that's those are the topics we're gonna dive into this month. I'd like for the docs who are in at this particular point to introduce themselves. And as usual, doctors will be coming in and adding themselves as the program goes along. Dr. Clark, can you please introduce yourself?
Sure. Good afternoon, Dr. Kevin Clark. I'm a surgical oncologist. I work at North Beth Israel. Glad to be here today. Looking
All right.
forward to hearing the discussion.
All righty. Excellent. Excellent. Dr. Atherley, please, you're next.
Good afternoon. My name is Trevor Atherley. I'm an interventional cardiologist, and I'm primarily based at Newark Beth Israel Medical Center.
All
Good to be
right.
here with you.
All
Hope to
right.
learn something today.
Yes, yes. But also we got to have good questions coming from the docs as well because we don't do this every day. So, this is it's a time for us to learn as well. All right. I'm Dr. Omar Bey. I am a retired pulmonary critical care physician, and now I'm director of nutritional support for the ICU at Beth Israel Medical Center. I'm so pleased to have Dr. Kevin Holder with us this month. The brother's just awesome. I mean, for the last 40 years, I've referred patients to him. Um, it's just been an awesome connection that he has with the local patients here in the Newark area and what he's doing as far as holistic medicine. Kevin, this is what I would like. I'd like to just be I know there are people out there that are listening that, and some of them just may be interested in holistic medicine. Can you give us an understanding, how you got where you are, why you're so passionate about it? And let's just start off that way before we get into the real discussion.
Okay. Thanks. Good, brother. Omar, thanks for inviting me on. Dr. Clark, Dr. Atherley, greetings. Okay, it's a pleasure. Dr. Atherley was part of my training. Thank you very much. So, it's my pleasure to be on and to be a part of a program that is looking to improve the health of our community. That's what I want to say first and foremost, because the reality is that the health of the planet needs assistance. The health of the countries need assistance. The health of this state of New Jersey needs assistance, and the health of our community, especially the Black American communities, need assistance. We're here as doctors. My journey is pretty interesting, and I'll keep it short. But I'll just start with just little blocks of the progression. It started when I was 8. So it was when the question was, what do you want to be? And I said, I want to be a doctor when I grow up. So it started when I was 8. And they asked the question, why? And I said simply, and this will be the theme throughout, to help people. Okay, to help people. I don't know that, I was aware that my grandfather was ill and actually passed from cancer, but he was a very strong force in my life. So this is in honor of him, in honor of my father and mother, who are both gone now. But that takes me to the next aspect of this, and that is that I was trained before I was trained. Okay, so my journey started from my family health training. We all need to recognize that our families play a huge role in who we become. Well, it also had to do a huge role in my becoming a physician. And because I already had this orientation that I wanted to become a doctor and I wanted to help people, now I was in a family that considered health to be important.
Mm-hmm.
So that's an important one, because again, if somebody's going to go into this field or go into the field of becoming a physician, if you're really going to do it right, then you gotta have some kind of burning in your belly. You gotta have some kind of desire, or it's just a prestige or money or something else. But when you're talking about having people's lives in your hand, okay, it's a whole different ball game. And either you become desensitized or you fall back on the sensitivity that you have, okay, to help people and to be a part of helping the community. So again, I want to thank you for doing this, because this is, continuing to help the community. So that's part of the pictures. That's the first half of the picture. So I go through with this orientation of wanting to help, and now I'm paying attention. That's anybody who's going to go into the field of holistic medicine. I'm going to say, number one, go into physician as a holistic physician. That means holistic and physician. Physician is an honorable, venerable position. Okay, and I'll get to that maybe another time. That has to do because of the dedication, the time commitment, the effort, okay, the hurdles we as Black physicians certainly had to go through. And I have certainly a lot of stories to tell in that regard, okay, in terms of opposition to my moving in this arena. But there's a whole lot that's required to get through. So anybody who's thinking about going in, listen, have your bearing straight. If it is because you want to have a good life, that's good. But remember, your good life is going to be based on the good work that you do. And so we want to make sure that you have an emphasis on the good work. So now I go into undergraduate. Okay, was kind of recruited to an interesting undergrad, which was College of the Holy Cross, which is a very unique place because of the fact that the brothers there were very proactive. They actually took over. There's a whole story, the whole book that's been written on it. So Ted Wells is from Holy Cross. Actually, Clarence Thomas is from Holy Cross. These were brothers early on that this father went out and recruited, okay, in the inner cities and for African American males specifically. So that takes me to another point for anybody who is looking. You make sure that you go to some place who wants you there, okay? Because that's going to make a difference. You need support wherever you go, and don't just go because they're giving you money. Yes, that's important too, and they usually will if they want you there anyway, right? So I think it's important to understand, the undergraduate was going to a place where, I walked into a group of brothers at the school, okay, as well as a school that placed an emphasis on my being there, okay. Now I go through, and now the shock starts, okay. It's a small undergraduate, but it's an intense. And the pre-med program was one that you had to be accepted into. The biology pre-med program was even more exclusive. And most of the people, as you all know, in any program, most of the people who start out pre-med, it usually dwindles down to, in my school, it dwindled down to 10%. Okay, and I ended up being the only one graduating, okay, from the pre-med program. So you got to be ready, okay? You got to be ready. That's why having a passion for why you want to do something, despite the opposition, is so important. So you give me an opportunity to talk to this, like you say, to those who might be out there who might be considering this. Now, I go through, and I now end up, they wouldn't accept me into the biology pre-med. So I actually did sociology pre-med, but I still maintained my focus in biology. So I had enough credits by the time I graduated to have a biology major as well. So that was a lot of work, okay, a lot of time. But again, had some good people around. You have to have good people in your life, and good people that you're walking this walk with. So even though I didn't have people, any brothers and the added sisters after the year I got there, didn't have any other brothers and sisters with me. I had brothers and sisters around me, as well as other good people. Okay, just good people. So I went through, worked hard. Was told, first advisor by my advisor. I think you need to change. I think it's my third week in the school. Okay. And he's telling me that I don't know whether this pre-med program is really for you. I think you might want to consider, something else. I walked out of there devastated. Who are you talking to? Okay, you don't even know me. So that's again, there's going to be hurdles. There's going to be work. There's going to be time where you're not going to think you're going to make it, but you got to know why you're there. Okay, so I go through, I get through. I do well. I get accepted into a few medical schools. End up going to UMD&J, Rutgers Medical School down here. Okay, because of another program. Okay, because my pre-med advisor, Michael McGrath, never forget his name. And that's his. He was very, says, listen, I want to make sure, okay, that you're doing this. You're after the first year, the first semester. Okay, it was a rough semester, but you did okay. You got through. Okay, you still got some hurdles to go because biochemistry is a weed out, right? That's a weed out course. So I go through, and now I'm making it through. And now there's a support aspect, a little program that at New Jersey Medical School. Okay, so summer program that I attended. Again, camaraderie, support, Foster Burnett, okay, and other individuals that were at the school, okay, kind of made you feel wanted. So when it was time to go to medical school, I got into University of Medicine, as well as a few others. But again, you want to be someplace where you're wanted, okay, as well as someplace that there's going to be, good energy, good vitality, good people who support you both personally as well as professionally. So I go through medical school, but all the while, even an undergraduate, remember, I've already had my training, which was my family health training, because the emphasis on health was there. So my parents were drinking wheatgrass in 50s and 60s. Okay, so so there was already an orientation for health, which I'm observing. Okay, so I get into undergraduate. So when I hit a biochemistry course in undergraduate, um, I'm like, whoa, this is showing how the body works. Okay, because if this pathway gets blocked, and I had one course that was called inherited metabolic diseases. That means if there was a metabolic block, okay, and I remember that one of the diseases was Lesch-Nyhan. So you might remember this one, which is a self-mutilating disease that happens because of a genetic defect that then causes a biochemical imbalance that builds up too much uric acid and other things and causes the individual to actually self-mutilate. Okay, so here it is. Okay, I'm looking at helping people. Well, if I'm going to help somebody, then I have to understand what their makeup is. Okay, so that was the first cue to now understanding how to help by looking at what their makeup is. So biochemistry ends up now in medical school. You have to take it again. Now I see that that's nutrition. Okay, that's nothing more than nutrition. And so when you understand, the metabolic pathways, and you're looking at it, and you understand it's cofactors. That's what vitamins are. Cofactors. That's what minerals are. The enzyme pathways, your production of energy comes through your glycolysis pathway, and into the Krebs cycle, and on and on and on and on. And every step along the way, there is a process that has to go forward in order for the individual to be well. All right, so that takes me through medical school. I then glide through. Of course, some of you may know I took it upon myself. Okay, that's the other thing, is that you got to pursue what you want. Okay, the educational system is not going to give you what you want. It's going to give us our profession, and it's a glorious one. Okay, it's rigorous, and it sets the standard. The MD sets the standard, okay, because there is a discipline that really establishes the discipline for all other medical arenas. Okay, so I get through that, but I'm looking at how can I help people. So I now start to look at senescence within the library, the George Library. I met a guy there in the library, and he was looking at a book on senescence. That we know that now is longevity and the aging process. And now that takes me into cellular health and understanding the process that's taken place over time. So from there, I go into, as I graduate from medical school, then I have to make a decision what I'm going to go into. So I go into medicine and pediatrics, okay? Internal medicine and pediatrics. I do a double residency. It's like I did a double in undergraduate. I go into a double residency because for me, I'm looking at the continuum of an individual's life and what happens. So it gives me insight into how can I help people. So when I'm looking at an infant, I'm looking at them when they get to be 50. Okay, when I'm looking at somebody who's 50, I'm looking at them when they were an infant and how they've gotten to where they got to. So that takes me into an orientation, okay, where I now start to set up as I go to my residency. Of course, that was grueling. At that time, they got it like cake now, At that time, we were up, they didn't care whether you slept or didn't sleep, okay? You better be ready for a morning report, okay? And the resident goes home, and the intern stays home and stays up, and on and on and on, okay? So I go into residency with the orientation of, okay, how am I going to now understand how to help people further through this window of internal medicine and pediatrics. And then from there, I am establishing the holistic perspective, which I can talk about if you wish.
Excellent. You know what, Kevin? I think we all should do that, what you just did, because we all have a story, man. And you just took me back to those days when, man, and I'm sure each and every one of us can relate 100% to what you just said, and to give people, or the brothers and sisters out there that are coming into the field, a true understanding of what came before them.
Right.
And, the importance of them taking on this position and what's ahead of them, and it's so important. So
Dr.
This reminded me of one thing. 1 second, Kevin, is that there was also, in terms of what comes before, because that's so important. There was also a brother, okay, that came, was the only one who had graduated before me. Brilliant guy, okay, who actually went to UMDNJ. It's been so long. I can't believe I can't remember. It's Carl Murray. Carl Murray.
Yeah, I remember Carl Murray.
Yeah. And he was already out by the time I'm going into medical school, but he came around and he, gave me a little ins and outs of, how to make it, this aspect of that, that you not knowing the history, okay, of what's taking place before you is such a diabolical, I think, intentional thing done, okay, to decrease one's success rate.
Yeah, I agree. I truly believe that, if you don't know where you've come from and what's happened prior to get you and allow you to be even alive and moving forward,
Right.
It's hard to know truly how to go forward.
Right.
So your past means a lot. It means so much. Let me do this real quick. We have two physicians that have come on. Dr. Patrick Anderson, can you introduce yourself, please?
Hi, guys. Can you hear me?
Hey,
yes, we can.
Yes, Patrick Anderson. No stranger to this group. I feel like I've been mentored by every single one of you guys, and I partner now with other member on the panel. Dr. Clark and I, we're like twins. They keep calling me Dr. Clark. I'm like, all right, guys. So I'm just glad it's Dr. Clark. But yeah, Doctor, I think there's a great story that comes out of this. Because I think, like Dr. Bay says, we all have a story, and we should at some point tell it. But it's woven in the fiber of this group. Back then and today, and I see it being remaining in the fiber of this group in the future. So, I'm a GYN oncologist. I'm at North Beth Israel, and for me, this is a great space to be in.
All right, thank you, Doc. Dr. Court, please.
Hey, I'm sorry I'm late, but I had to take care of patients, but I couldn't miss it for anything. I'm among friends.
Yes, you are. All right, but who are you? What's your what type of doctor are you, Doc? Don't cut it too short.
I thought it was known, but I'm internal medicine, graduated from Howard University. My practice is located in East Orange, New Jersey, and I'm among friends at North Beth Medical Center.
So you are definitely among friends. That is for sure. So Kevin, let's step back just for a minute. I just want to get really basic because I mean, I don't want to get too technical, but you do something that we don't do in Western medicine. A lot of the things that you do in your office, we don't do. But the patients that come to us, I think, just by from where they are, their cultures, stuff like that, there is a lot of natural medicine going on, period. So I know over the last 40 years, I've sent you so many patients because, I want them to go to somebody who really understands the concept, knows what's going on, So just tell me, what's a typical patient? I should start off, what's a typical day for you? All right, let's start with that, and then we'll start talking about patients and stuff like. But what's a typical day?
So, today's day is different than its last year, and different than 5 years, different than 10 years, and 20 years. So if I'm in, the place where, I have to control, the flow. So the day I've set it up so that I can manage, things much easier. So the day to day in 2026, in the last 3 years, obviously medicine for a lot of people have changed since COVID, but is very different. So I really should discuss how it was. you know, a typical day 10 years ago, for the first 30 years of my practice, was in the office by 8 and leave the office by 1 a.m., at least 2 to 3 days a week. It was one that it didn't matter to me because the patient in front of me was the only thing that really mattered. I had to try to go through my process, because what I've done is to formulate a process after the first 5 years in practice. Even going into practice, I already knew a little bit of orientation. My orientation was this concept of developmental medicine, okay, meaning the development of health or disease over time, okay, from infancy all the way to death. So but when we look at the day, it was come in, get set up, get ready for, you know, the patients, starts to pull some review, and then the day really just rolled. Okay, and now that day, for me, it was, if a patient was scheduled for half an hour, it might take an hour and a half. I mean, that's just the reality, is that when I get into a patient, because of the work that I do, the person unfolds with their whole life, because I'm looking at them from a developmental continuum, from a historical piece, obviously in our HPI, but also in terms of a psychosocial piece that then relates to the mind-body piece. So there's a lot of parts that we're interweaving. So that I could also work with them. So the work that I do is from mind to body, body to mind, back and forth. Then weaves in their family history, as well as their family dynamics, as well as their community, and, you know, everything that has to do with their style of life. So that pretty much takes me to the day. I mean, it was basically work and then family. Okay, it was, I had a large family, so I had to kind of cordon off time. I kept my office. First, I had the office in Montclair. Then I brought the office to my home within the first 5 years. Okay, so that I could make sure that at least my family was there. So my office was open. My sons or daughters could walk into my office at any time. Patients had a problem with it, that was their problem. Okay, because I'm there in this office so much. So that's kind of the brief story on, what a day could look like.
Definitely. We have some questions coming through already. So why don't I at least let's take one question, Kevin, and then we'll go from there.
Before you start, could I just ask Dr. Holder?
Yeah, go ahead.
So you brought us to the point where you did the residency. And could you tell us about the next transition? What made you switch from doing, I'm going to call it conventional medicine, to doing holistic? What factored into your decision at that point? And then the other follow-up to that is, if somebody was to follow along that track, is there such a thing as a fellowship in holistic medicine? How would you get to the point where you are at?
So I kind of created a pathway. There are pathways now that are out there. That's you can get there through a fellowship in lifestyle medicine. Okay, I think Johns Hopkins has one. There's several of them that exist. There's even at Harvard now. Okay, they do a fellowship in lifestyle medicine. So there's places now in the last probably about, I think they started about 15 or 20 years, about 15, 20 years ago. I think the lifestyle medicine program at Harvard started about, I remember when they first started, I actually went up there to check it out. So that's a good 12 to 15 years ago. So yes, and answer to your question, there are places to go to get additional training. For me, that's a little bit rudimentary. I think if anybody's considering going into the arena, they first have to get the basic sciences down really solid. Okay, that's number one. because I rely upon the basic sciences in the work that I do, because I got to make the jump, okay, from the person's clinical condition to an actual substance that's going to assist them rather than a drug. Okay, so that requires that I'm always looking at this biochemistry, the pathophysiology, and the understanding of signal transduction in terms of cell membranes, et cetera. So get the basic sciences even in undergraduate, okay? Because now with the specificity and the amount of knowledge that exists, there's a lot of science. I have students that come from Seton Hall. They seek me out to do actual time with me so they can go through and get to medical school, okay? And I only accept them for not less than a year. And they come in, volunteer their time, and they get exposed and to the process. So I know some of the stuff that's being taught, and nowadays with genomics, with translational medicine, with the understanding of the proteomics, et cetera, okay, there's a lot of information in undergraduate that can really serve one well. So back to the fundamental aspect of the question, the transition from residency to practice. In residency, I'm already looking, well, first of all, in medical school, remember, basic sciences, I'm looking at how the body works, okay? Really paying attention. Then in residency, now I'm looking at clinical conditions and how people get into those clinical conditions, okay? So I'm talking to them. I'm really looking at their family history. I'm really looking at their lifestyle. I'm already doing that, okay? And then going into practice, okay? I've already got a formulation because I'm doing internal medicine and pediatrics. I've done, the residency in internal medicine and pediatrics. So I've seen, a United Hospital, meningitis, asthma, kids dying from asthma. Looking at the pathophysiology, looking at their diets, looking at what's been done, looking at their history, okay, and seeing that, they're just, and nowadays it's very common, but that back then, 35 years ago, 40 years ago, nobody was looking at this, okay? So they're on an inflammatory diet and they're increasing, their leukotrienes and increasing their bronchospasm. So I'm looking at this stuff and then doing things even in residency, okay, to in that clinic, because we had a clinic, right? We had our own clinic at University Hospital. Okay, so I'm already looking at how to intervene first and foremost, these enzymatic pathways, which means biochemistry, which means nutrition. Okay, so then I go and I look at energetics, okay, because we have to understand the difference between Eastern and Western medicine, right? We want to talk about the different aspects of how we're trained, which is a glorious training because it is looking at saving lives. Okay, if you got somebody with a blood pressure of 210 over 120, you better get the blood pressure down. Okay, so reductionistic medicine, which has looked at different pathways, and now come in a lab come up with a drug that can mediate that pathway. That's what I call grace and mercy. Okay, it's to give the person more time to be able to look at some of the stuff that I'm talking about. Okay, so I'm a physician first. The role of the physician is to do no harm and to also to reduce morbidity and mortality, right? So once I am at a certain point, now I start looking at, okay, the other aspects of how the body works. I got a lot of the nuts and bolts of systems, cell biology, physiology, pathophysiology, et cetera, pathology itself. So now I have to look at the other thing because that's not all that we are. That's only one part of what we are. What we are is we reside within this car, okay, with all these different systems, okay, and the person who's driving the car has an impact on those systems. And either it's going to thereby you're going to do what's necessary to make sure that car runs properly, change the oil, make sure it has water, make sure it has, proper fuel, make sure it's clean, etc. So this other part that has to do, when I'm just going to simply name the energetics of the body, has to be looked at as well. Right. That's where we get into what we call the mindset, but it's more than mindset. It has to do with the energy of the person. It's right now you're living because there's energy that's flowing through you. Mm-hmm. Okay. And that energy is flowing through you based upon how you think, what you feel, and what you do. That is that's the other aspect of medicine, okay, that oftentimes we didn't have time to really pay too much attention to. Or if we do, every physician greets their patient. Every physician, I hope appreciates their patient, okay, and cares for their patient. But there's a science to that, okay? And that science is a piece that I've worked on for the last 40 years. Mm-hmm. That has to do with, okay, and I'll just give one other piece on that, Kevin. So I had to formulate different models. So I've formulated many models over the years. The initial model was this, that a doctor does this. He diagnoses, he treats, he's supposed to educate, and he refers. Okay? Everything we do falls in those 4 categories. Okay? All right? Okay, so we diagnose, treat, supposed to educate, and refer. Okay? My holistic model was, I said, well, that's not quite all that I'm doing. Okay? I approach it differently. Okay? Because the holistic piece has to do with, I'll talk about the different aspects of the evolution of this, but has to do with, number one, is understanding. For me, it's understanding, which means I have to understand the person and their body. And understand the person, I have to know where they've come from. I have to understand dynamics. I have to understand thought processes. I have to do as a certain type of interview that's done that's related to what's called homeopathy, which is completely, I remember in medical school, Quinlan saying, you better give this person some medicine and I hope it's not homeopathic dose. I didn't know what he was talking about back then. Okay. But homeopathy is a discipline that started way back. I'm not going to get into that, but it has to do with a certain way of listening to the patient. That actually, when I went up to Harvard in their lifestyle medicine, they were actually talking about that kind of interview. Okay. Because they had developed this kind of motivational interviewing, is what they called it. Okay. This is what I would refer students to as a beginning platform to be able to understand how to get into this aspect of holistic medicine. So as I came out, Kevin, I looked at this model and I began developing this model and then grasping the resources. So I had to look at acupuncture. Okay. So I took an acupuncture. I found an acupuncturist that I studied with. Okay. I looked at the aspect of acupuncture from a medical standpoint. Then later on, I took the course up at Harvard. Harvard has a medical acupuncture course. Took that. Okay. But it was not so much for me, acupuncture is very complex and very detailed. Okay. So I got the acupuncture. I also started with a couple of disciplines, something called cell salts, okay, and the use of cell salts to affect the body. And I began to gradually accumulate a body of knowledge over the first 5 years, and then practice that matched, my curiosity and my thought process of the body. How does the body work? Because in order for me to help people, not to treat, because I go from understanding to improving function. It's the second, instead of just treatment, it's improving function. And then it goes to generating awareness. Okay, that's the educational piece, is generating awareness for me of them within and without. And then the aspect of understanding the use of resources, their own internal resources and resources around them. So that was my model, okay, for the actual practicing of medicine, which required the understanding of listening and understanding so that we can get to a place to understand how the body works and what's going on with their body, what enzyme pathway, what can I mediate, what can I adjust, okay? And that's where I get in, went heavily into the nutrition, and then found, the discipline of acupuncture, and the 5-element theory and herbs, okay? Because for me, herbs is just glorified nutrition. You just have to understand they have a history. They haven't been studied as much because in Western medicine, they want to extract. It's a reductionistic piece. They want to extract the active component. Digitalis comes from, digoxin comes from digitalis. That's a plant, okay? Many of the medicine, obviously penicillin comes from mold, okay? So there's a whole process that has to do with how systems relate in the ecology of the world in which we live. That has to do with how the balance of forces that then tells us about ourselves. So I deal with the nature within and nature without. So that's a long, maybe a little bit more than what you asked, but that's a little bit of how I kind of evolved, not really changed, okay, evolved, into this practice of taking a holistic approach. And most of it was carved out, okay? Mm-hmm. I could have probably begun my own course, but I was so busy with my family and the practice that, I just...
We can only do so much, brother. Kevin, you still got your hand up. One more question?
No, that's my hand.
No, actually, I do have a whole bunch of questions, but I don't want to...
Just one, though. Just one. I know. We're going to get to all the questions, and we're going to get to the questions.
Just really quick. Is
dialing in.
When people mention holistic medicine, are we always talking about the same thing?
Good. Thank you. Great question. Okay, which I was mentioning I was going to get to. Okay, so, the reality is this, okay, that holistic medicine is where I start, what I'm describing is this whole approach. For me, it was WHOLISTIC. It's HOLISTIC. So I do need to help you understand that holistic medicine is going to incorporate a lot of other things. So therefore, when people are talking about holistic medicine, they oftentimes are talking there could be 5 different people talking about 5 different things. Mm-hmm. Okay. So I incorporate all of it, okay, because I started and built over time. So there was alternative medicine, okay, was what it was early on. Alternative medicine is not what I do. I'm not trying to give an alternative to a drug, okay? You need a drug. I will find things that will assist, okay? Yes, it can be an alternative, but that's not all that holistic medicine is for me. So there's alternative medicine. Then there was integrative, actually complementary medicine, okay? Which was, okay, well, we're complementing, okay, the medical approach with some other modalities, okay? Then we have integrative medicine. That's when the institutions started to get in. When I went down and did a presentation down at Duke when they were just starting, okay, their integrative program, okay? And then it's now evolved to functional medicine, okay, and even wellness medicine, okay. So your point is well taken. These are all terms, and there are many. What we need to understand is the aspect of modalities. There's many modalities under the holistic approach, okay. So when I'm looking at the musculoskeletal, okay, I've already had to look at how massage is going to assist. Okay, how kinesiology is going to assist, how even chiropractic, what's the basis of the chiropractic and where does it fit in? So all of these are holistic modalities, okay, that exist. So when people talk about holistic medicine, they can be talking about a lot of different things. So,
all righty. We got a lot of hands up, and we got a lot of questions coming in from the outside audience too. Dr. Atherley, your question, please.
Yeah, I really appreciate the comprehensive approach that you're using, Kevin, and admire it. But I have a basic question in terms of the urgency with which we treat patients nowadays and the need to move ahead pretty quickly. Does your approach essentially and fundamentally require long duration, multiple evaluations, et cetera, in order to get to the seat and the bottom of the problem with the patient? and to be able to handle it over a long-term basis.
Yeah.
Is there a lot of time consumed in this regard?
Yeah, it's been arduous. Okay, it's been a commitment. Obviously, not as much time. There's time. I hear two questions there. There's time in terms of looking at the effectiveness. I'm going to answer these questions separately. The effectiveness of the approach and the modalities. Right. That's one question. Versus the time that's used for medication to take care of a problem. So that's one aspect of the question I hear. Is that correct?
Yes.
Okay. The other aspect is how much time is needed, okay, to actually understand what the patient needs, So that's the two basic questions I hear in what you're asking. Is that correct?
Yes, it is.
Okay. So that's why I'm a holistic physician, because it's not that I don't believe that that the medicine is evil, or I believe that medicine is evil. I believe that medicine is, as I mentioned earlier, is actually a grace, okay, given because you need something that's going to impact, okay, the person when they come in. If they're coming in with pneumonia, okay, or they're coming in with, anyway, crisis kind of medicine, I'll just put it that way, then they're going to need something that's going to impact. And medicine is designed to do that. That's the first aspect to the question. Second, in terms of, are there things that can also act quickly from a holistic approach? Yes, absolutely. Okay. It may take more time on the other side, okay, to get it right. Okay, because it's such a holistic and comprehensive look at the patient. So if I can give you an example. I a patient who comes in with asthma, okay, and their peak flow is 350, okay. Give the right remedy, and their peak flow goes to 600, okay. But I got to find the right remedy, because from a holistic standpoint, it's individualized. It's not like that remedy is going to work for the next asthma patient that comes in. Yes, it may, okay, but it's not like a drug where you give asthma, or you give Ventolin, okay, this is going to happen, and it's designed to happen for these patients. So, so that's the quick answer to that question. Again, each one of these questions has got a lot of richness to it. So it takes time to understand the patient, okay, to impact them over time, and for them to be, because they are the CEO of their health. This is what I tell them. They're the CEO of the health. Okay, from a holistic standpoint, it's not the same as going into, the doctor's office and going out with the drug, and they don't necessarily have to do that much. Okay, even if you do make lifestyle changes. So I think it's important to understand that we're dealing with people, we're dealing with a history, we're dealing with not only their history as an individual, but also their family history. So now I get into another equation that I use: 3 factors that affects one's health. It's only 3 factors, okay? And that's genetics, environment, and lifestyle. Everything from that. I did this 30 years ago in terms of re-engineering your health. I used to give lectures on this, okay? 30 years ago. I remember I did one at Maurice, okay? They invited me to go there. And it was called Re-Engineering Your Health. And I kind of worked these equations and this approach over years, right? And so genetics, environment, and lifestyle, okay, are the 3 factors that affects one's health. People are not going to be able to just change their genetics, okay, just because they want to. Now, understand this. We know genes do jump, and we know that we can access and we can actually turn on genes and turn off genes, okay? And some of the things that I'm doing when I'm working with, I realize actually even have that kind of an effect. That's the reason why it can change quickly. So I think it's important to understand that the relationship with the patient is something that takes place and takes work over time. And you got to have patience. That's another equation I use. Patience plus process always equals progress. Okay. So these are the kind of things that I've worked through to help patients to understand how to be a part of this process of their healing. Does that answer your question? I hope.
Yes, yes. It was quite an appropriate answer to my question. Thank you.
All right, thank you. Patrick, you have your hand up.
Yeah, this is some questions and comments, and it's directed at our audience. Um, I want everyone to look at Dr. Holder and understand that Dr. Holder practices a brand of medicine that's a little bit unconventional. But, to put it in perspective, Dr. Holder practices a brand of medicine where he collaborates with conventional practitioners more than we actually think. Because, it comes down to what I call discretion and valor. Okay. When you go to see Dr. Holder is a different expectation than when you go to an emergency room, right? So if we use asthma as an example, a chronic asthmatic goes into Dr. Holder's office, but they're not in respiratory distress, right? And the reason I make this comment is I look at a number of questions, and some of the questions direct your attention to an immediate answer. And Dr. Holder highlighted, the factors that goes into a practice in successful holistic slash complementary slash lifestyle medicine. And that is you have to make those investments long term in lifestyle changes, habit of practice, and investment. When you decide to come to see a Dr. Kevin Clark because you have a bowel obstruction, or Dr. Athlete because you're having chest pain, you're not going to go see Dr. Holder for that level of care. We're going to deal with what's acute. Then we're going to send you to Dr. Holder and have him counsel you and intervene in how you can make the adjustment to decrease your incidence of chest pain after we figure out why you're having that chest pain.
Very well put. Very well put.
Yes. I understand this, that patients come in, and if they come in with chest pain, I'm evaluating and referring where necessary. Okay.
Exactly. Exactly.
Okay.
Mm-hmm. Excellent. Excellent. Dr. Court, your hand is up.
Yes, it is. Hi, Dr. Holder. My question, if we're going to refer back to the patient with asthma, patient comes in, say, actively wheezing. How do you treat such a patient? What do? You send them to the emergency room, or you add whatever? Yes.
So it depends on the case. It's all, again, we as physicians have to preserve life. If the person's coming, it just so happened, if I gave that patient something and he didn't respond, he's in the emergency room, or I give him a nebulizer treatment, or I do what's necessary to make sure that he's going to be okay. I've never had a patient die from asthma. Okay. I've never had a patient die from hypertension. So I will tell you that I didn't have any patients die from COVID, of all of my patients. Okay. And I had 90-year-olds, etc. But that's because they were prepared. And there's certain things that they were prepared by. So in answer to your question, they come through. It's still a matter of understanding. I'm a physician. Okay. I know how to evaluate the severity of disease. And I'm going to always be looking, as Dr. Anderson's already mentioned, going to be looking at, okay, what's their level of health or disease, and then act appropriately. But that's a great question, because people need to understand that example that I gave, okay, that's just that. Not every patient who comes in am I going to do that. And there were certain reasons why I did that. Okay. Other times they may call me on the phone, and it may be that, I'm having a hard time breathing. You got to go to the emergency room.
Mm-hmm. Yeah.
So in other words, you also do other modalities in addition to what?
In addition to, I do multiple
conventional treatments. Say, for example, patient with asthma. If they're not wheezing, say for example.
Yeah. So, but that gets into, now we're getting into treatment. So I'll just do it because we got to be careful with people on the line, okay? Because I'm not giving specific recommendations, okay? Right. But yes, there are very specific things that I'll do to assist to reduce the number of attacks and to reduce their level of either chronic asthma or recurrent or intermittent asthma. So yes, that has to do. I've done acupuncture, I've done nutritional work, I've done herbal. Okay, I've done homeopathic. So if that answers your question.
Excellent.
Right. Yes, it does. I'm satisfied.
Excellent. What I'd like to do at this particular point is I'd like to take our halftime break. And then after that, we're going to come back and take some of the questions that people have been typing in because they're really good. All righty. So first, I'd like for each doctor to reintroduce themselves, and then we'll pull forward here. Dr. Holder, just a short reintroduction.
Yeah, I'm Dr. Kevin Holder, practice here in South Orange with a holistic approach, internal medicine and pediatrics. And thank you for having me.
Excellent. We're thankful that you're here, brother. Dr. Anderson, please.
Yes, I'm Patrick Anderson. I'm a gynecologic oncologist. I take care of women with cancer. I work in the Barnabas, RWJ Barnabas system, primarily out of Newark, Israel. I'm always happy to be here.
All righty. Dr. Court, please.
Good afternoon, Dr. James Court. My specialty is internal medicine. I only treat adults. I'm located in East Orange, New Jersey.
Dr. Atherley.
My name is Trevor Atherley. I'm an interventional cardiologist, and I practice primarily at Newark Medical Center.
All righty. And Dr. Kevin Clark, please.
Hi, good afternoon, Dr. Kevin Clark. I'm a surgical oncologist. I work at Newark Medical Center.
All righty. And I'm Dr. Omar Bey, retired pulmonary critical care physician. Right now, I do nutrition. I'm director of nutritional support for the ICU at Beth Israel Medical Center. What I'd like to also say is those who are on the webinar know that it's most second Saturdays. I used to say every second Saturday, but it's most second Saturdays. We will be here to answer your medical question on various topics. And please just check the website to see if we're coming on that month. And I will try to put things out on social media to let you know where we are and which months we're going to come back. July and August, we're going to take off for vacations because a lot of the docs are on vacation and I will be on vacation. We will be back in September. Okay. If you want to see our past webinars, all you have to do is go to the website OBHealthy and click the YouTube sign, or there's a camera right there on one of the pages, and you just have to click that. All of our past webinars come up. Please, go in, check out the topics. It's a wealth of medical education there just waiting for you. The most important thing that I can say today is please do not change any aspect of your medical care until you consult your physician. Truly, only your doctor can truly take care of you from a medical standpoint. I'd like to thank OBHealthy for allowing us to bring this webinar to you. Without them, we would not be able to do this. All righty. Let's get to some of our questions, and I'm going to try to bring them up. Hold on for a second here. If I can move this, it would be nice. And it won't move. Here we go. All right. The first question is, let me do this. This will have a personal hook for you, Dr. Holder. What's your thoughts on the impact of immunotherapy on cancer resolution today? And could you comment on Professor Patrick, I think it's soon, Sigon's work in this area? So immunotherapy and cancer, I'm going to let you handle it from there. If you can give us some thoughts on that.
Talking to me or to Patrick?
Oh, no. No. Hold on. Did it come through as Patrick?
No, I
Well,
think
the researcher's name.
No, the
Patrick.
researcher's name is Patrick, not Patrick.
Yeah.
Okay. So immunotherapy is interesting. Immunotherapy actually was poo-pooed years ago. There's a Dr. Burton who's passed on now. He was actually from Cornell. Then he had to locate the Bahamas. And he understood that there's relationships between the cancer and the body and the immune system. And he began to mediate those relationships, okay, with these injections of serums that he would use. and had response. But at that time, 30 years ago, he was really kind of uh, ostracized. I'll say it. Okay, um, and but he still he ended up, he was from this area. Ended up in like I said, in the Bahamas, practiced there, and he's passed on because he was up in age. There was a Dr. Ravisi also who had done some work in understanding the relationship again of the body to the tumor and the immune system, and began to work. Now immunotherapy is uh, as a whole burgeoning field, and I'll leave that to Patrick to maybe comment on that a little bit.
Yeah, I think, to understand, and I can speak to cancer more specific, but make some general comments. And Dr. Clark can add some comments as well. When we talk about immunotherapy, we're talking about how do you utilize the power of one's immune system to influence the outcome of an illness, right? And if you take it in the broad sense of the definition, vaccination is a kind of immunotherapy, or at least an immuno complement intervention. And what I mean by that is, you know, many illnesses, and if you take infections, for example, infectious agents, for example, viruses and some bacteria has, protein on their outer surface, which we call antigen. And those antigen does create a recognition pathway by the body, right? So then when you create a false sense of exposure with a vaccine, your body already recognizes it and makes antibodies as to how to defend yourself against it,
Mm-hmm.
right? And that's in the broad sense. When it comes to cancer, for example, the questions we always ask, why does two individuals, same gender, possibly same age, probably even twins, will have a same cancer based on the broader diagnostic label, but responds differently to the same treatment, right? And then you can say, well, it's influenced by stage. And what I mean by that is how expansive was it at the time of diagnosis?
Mm-hmm.
But if you put all the factors together and all things are equal, why do some people have a better outcome than others? So then you start to look at what's expressed molecularly
Mm-hmm.
on the surface of individuals' cancer, and you realize that same cancers have their own intrinsic biology, and that really is influenced by these molecular expressions. And sometimes we talk about targeted therapy, and that's usually when we send them out to these laboratories, and they do look for these molecular markers, which based on clinical trials are known to be influenced by certain medication. Now, the challenge that Dr. Holder has is to understand these molecular markers and how some of the natural agents that he works with, many of who what we use conventionally because they come from a natural source, but how many of these agents impact the expression or the molecular expression on these individuals' tumors.
Mm-hmm. Mm-hmm. Very good. Very good. Very well done. I think Patrick covered that pretty well. Did you have anything to add, Kevin, or I mean, Dr. Clark? Or
I won't belabor it. I know we have a lot of questions, but immunotherapy is one of those fields, as Dr. Holden mentioned, initially because the results were poor, people didn't really understand or believe that there was an immune response to cancer, but clearly there is. I think the major breakthroughs have been immune checkpoint inhibitors, which are drugs that really release the inhibition that cancer cells put on our immune cells. But I think as a whole, immunotherapy involves a lot of different approaches. But its attractiveness is that it's supposed to be a more durable response and utilizes the body's own mechanisms, which we know exist
Mhm.
to fight the cancer. So that's the attractive point.
Mhm.
Yeah. And also what's attractive, you can tailor it to an individual. based on, their own molecular marker. And I think over time, what has happened in the science is the ability to identify specific markers and specific factors that's beneficial has become more and more sophisticated and better understood.
Yeah, yeah, because yes, that's because you see, there's proteins that are secreted by the tumor, okay, that thereby affect the actual immune system. And as Dr. Clark mentioned, okay, they actually inhibit and they become irrecognizable. Okay, the tumor becomes irrecognizable, okay, by the immune system. So you have to break those inhibitors, and then there's things that have to do with VEGF and all substances that are being secreted by the tumor that allows it to increase its expansion and to break off and to go to other areas, and even to be able to seed. There has to be certain things that are produced by the tumor. So what Dr. Burton knew is that he was able to isolate some of these substances and then give it to patients, and they thereby prolong their survival. Okay, but nobody could understand that back then. Okay, but that's where now with precision medicine, okay, being able to actually take the tumor itself, as you're mentioning, Pat, okay, and now take it to the lab and look at its markers and on the tumor itself, as well as substances within the blood, okay, now that are being secreted by tumor. We know that, of course, the PSAs and that, but I'm not talking about those. I'm talking about other substances that are being secreted by the tumor, okay, that both breaks the body's different lines of defense.
And to speak to the whole concept, if I may take a few more seconds, the whole concept of the holism that's involved, and this is why this is so sophisticated. To Dr. Holder's point, when you talk about cancer and things that are supposed to be recognized by the body, sometimes what these cells do, not only do they create a sanctuary environment, if I may say that, but they also create substances that, one, lowers your immune system by affecting, your appetite, how you respond to nutrition. And that allows the body to become weaker. And that's why viruses, which causes cancer, is often more smarter than the cancer, right? Because they don't kill their host. Cancers often do, but not every cancer does, right? And when we talk about abnormal tissue growth, they're the ones that are malignant and they're the ones that are not. The ones that are not tend to be in line of a virus. They grow and they cause effect based on size and pressure. Then there's the one that are malignant that goes in and disrupts, right? And it disrupts many different mechanisms. They secrete substances that stimulate other cells to become malignant, or stimulate is like adding fertilizer to a soil, right? It allows the cancer to just grow, right? Whether through, a paracrine or an autocrine type of situation. But so immunotherapy is really a broad approach to dealing with cancer.
Excellent. I think that was well discussed. Definitely. Let's go to the next question. I have been getting very severe, debilitating lower abdominal pains near my pelvis and chronic constipation for about the past 2 years, in and out of the hospital, and MDs can't figure out what it is or what to do. What can this be, and what can I do? So we get questions like this. I know we'll discuss it, but it's difficult to discuss because each particular person is different, and you don't have enough real history to give a proper answer. But maybe we could at least give them some guidance as to going forward. Kevin, can you start it off? I know Patrick and Kevin may be able to help, and Dr. Court may be able to help with this.
Sure. From a holistic perspective, first of all, this is a diagnostic question. Okay, so that's why you're absolutely correct to say that the the patient's frustrated, okay, because they've already gone to doctors and they're still in a compromised situation, and pain will wear you down. So, I feel for you, and don't stop. Don't stop pursuing. If you don't get answered, there is an answer, okay? Now, in terms of pain, and you go through the common things first, which I would expect that they've done already, okay, to have done tests like your colonoscopy, like your ultrasound of the pelvis, like your even CT if it's necessary. All of these things I'm expecting that they were done looking for gross problems. Okay, if all those things are done, then we still have to also look and make sure that there's no parasitic infection. Okay, so there should be some evaluation that's done. Okay, because that could be, even though you don't have diarrhea, okay, and you don't have typical symptoms of a parasite, there aren't necessarily typical symptoms, but that's something that could cause abdominal pain. I'm sure they've already ruled out diverticulitis, okay, because they've done the scans, they've done the blood work, and I'm sure they've looked for inflammatory processes as well. Obviously it falls back on to, the jump category of irritable bowel, but I'm sure that they've entertained that. Short of that, we then get into the understanding of the person. This is where I get this stuff all day long. Okay, people coming in with symptoms that either the case has been missed, found many things that have been missed, okay, or it's in the gray zone. Okay, and this gray zone is either a functional zone, okay, or is an incognito zone. Okay, it's something that may be, for example, that abdominal pain may have nothing to do with your abdominal. It may have to do with your back, okay, and some impingement or some retroperitoneal, something that's going on in the back that could be giving some referred pain to the abdomen. So the case needs to be evaluated, and it needs to be looked at. Because of the fact that I am trained to hear the patient, it kind of guides me into first the broad areas of, is this pathological, is this functional, okay? And then into both the psychodynamic, mind to body or body to mind, and then into the differential diagnosis. So unfortunately, can't really give you I would not try to give advice except for you at least to understand that there is a process, and somebody, especially your primary physician, should be the one who is supervising everything that's done and really looking at it, not just referring, okay, and expecting those who have worked, whether it be GI, whether it be urologist, whether it be gynecologist, okay, to have solved the problem. They should be referring back to him, and there should be this primary physician who's really looking at you, who knows you, and looking at you and looking at the little things that could be missed.
Excellent. That's true. 100%. Number one. I mean, it's a global type of thing, but the most important thing that I think you said was that you need a quarterback. You need your primary care doctor to understand and refer off, and for that particular person to understand what the specialists that he referred off to are doing, what they ruled out, and what could be going forward, so they could explain it to the patient.
You would need more information for this, because this male, is it a female? How old is the patient? That would direct you in terms of what to look at. So just like that, it would be difficult to make a diagnosis without knowing what information so far has been gathered.
There's no way that you can come up.
Yeah. I don't think we can help with a diagnosis. Just give them some, and I think Kevin said, don't give up on trying to find the answer, because the answer is there somewhere. You just got to get to the right person to get the answer. It's out there. Don't give up. All right. The next question. There are various foods, oils, tools, and ways to naturally heal from aches, pains, and illnesses. If you are having an issue with multiple ways to solve such as slow digestion, bloating, main main question sounds like the last question, right? Main question is how does someone know the best place to start? Well, that's a good question, and how to go through sequences of different foods to help yourself feel better. So we're talking about foods. We're talking about how do you start. We're talking about what can we do for that? And this must be a common problem that you see, abdominal discomfort, bloating, that
Yes.
type of. Now, I'm not saying that we have to answer this particular question, but how would you approach that in your office, Kat?
Yeah. So, as I'm sure Dr. Court knows, as a primary care physician, okay, the history is number one. Okay, so there's two parts to this question. One is, okay, what how do I, or this person as the patient, go about, okay, dealing with their condition, their gastrointestinal condition? And then the other part of that question is they want to know, well, where do they start? Where's the self-care, okay, in regards to handling this condition? I think, again, I must say this, okay, that access to healthcare is a critical component of improvement of health conditions. So you must use your resources, okay, to your advantage. That's my fourth element. You must understand your resources, not just to operate on your own, but use your physician. If you have a physician, use your physician, okay, to make sure that they're organizing the case for you and giving you, are able to give you direction. Now, short of that, in terms of you have to understand if you want to look at what you can do along with the side of the physician, okay? Because the physician still got to guide and still needs to measure. One of the main roles of physician, and especially in this day and age of holistic, quote unquote, this avant-garde, everybody's doing holistic medicine, okay, is that you need measures. Okay, you need measures. You need a blood test. You need a potential objective measurement so that you know where you start, so as you're getting ready to do things, even if they're on your own, it can be followed in a systematic way. Okay, so the first thing, in terms of just a couple of things, I could talk about this a lot, but I'll leave it open to others, is that in terms of foods, okay, I can give you a couple of things that's very simple, okay, which the physician should start with anyway. Is you're going to go to the common stuff and do an elimination diet. Okay, just do an elimination diet. Okay, which means you could do a single day fast where you're just having, say, fruits and vegetables. Okay, or only having 2 fruits and 2 vegetables. That's all you eat for that day. See how you do. Okay, and do that for a couple of days. Okay, as long as you can, making sure you're drinking, etc. And then you add back another food and another food and another food. Or you can go the other way, okay, and that is to take away the common things, lactose and milk, okay? Take away your gluten, take away, some common things. And then see how you do, and you just keep eliminating, okay, until you basically are down to the 2 fruits or vegetables. So that's just a quick comment.
And Omar, if I might just add to what Dr. Holder just said, you know, we are the best steward of our body. We need to understand ourselves. And over time, we should develop an understanding of how different things affect us. And, it's kind of like practice. People say practice makes perfect. But I can tell you, if you practice the same bad habits, you become perfect at that bad habit, right? So if we're talking about foods, we should have a basic understanding of what good nutrition means and try to practice some good nutrition. Then you'll know if you're having symptoms, it's likely unrelated to good nutrition, but that good nutritional food may not work for you. Hence, for Dr. Holder, you can eliminate that, right? And make some adjustments. So, again, we are our own stewards. We need to understand the basics. There's a whole commercial, furniture commercial that says your educated consumer is your best customer, right? You have to understand the basics of that in which you engage.
Yes.
No, go ahead. Go ahead. Somebody else talking? All right. All right. This guy, excellent, excellent. I was writing something down. I'm sorry about that. I just, sometimes things key in my head, and I just have to write them down because it'll float through, and I forget. Getting old, y'all. Getting old. In the next question, is the best diet to prevent illness truly 100% plant-based? Good question. Data shows meat and dairy is inflammatory. Discuss the vegan approach. So I don't know if you buy into the vegan approach or whatever, but I'm sure you have patients that come in that are vegan. And as far as eating meats and dairy, what are your thoughts as far as that's concerned?
Okay. Well, I deal with this all day, again, for years and years and years and years. Okay. And of understanding food, okay, as medicine and understanding the nature of the every diet that you can imagine I've looked at. Okay. So plant-based diet is just a broad term, now that means that people are eating more from the plant kingdom. Vegan is vegan. Okay. Vegan is a animal, is a whole animal of itself, is its own thing. Okay. So I have to say this, okay. In my experience of years and years and years of practice and many and many patients, there is no perfect diet. Okay, I must emphasize this. In short, I'm going to have something that's coming out at the end of this year that talks about living in 2026 and beyond, and as it relates to how do you mitigate disease and the different levels of mitigating disease, which is an answer. It's in relationship to this question, which is, okay, what's the best diet to prevent illness? So I can go into this in a lot of detail, but I just want to say this, that it's not simple. Okay. There are vegetarians, okay, that have diabetes. Okay. And there are vegetarians that have heart disease. Okay. Believe it or not, less. Okay. Less. Yes. Plant-based traditionally. Okay. Vegan traditionally has a lower incidence of chronic disease. Okay. Still does, but there's a lot of mitigating factors that I'm now having to deal with, because what I could do with food 20 years ago, 25 years ago, I can't do it now. Mm-hmm. And there's reasons for that. Okay. So that's the short answer.
Mm-hmm. Mm-hmm. If I might ask Dr. Holder, in terms of discriminating between one source of nutrients versus another, are there essential elements that are primarily animal-based? For example, some amino acids, which as you get older, you need those protein to deal with tissue repair and so on. So are there ones that are primarily animal-based, ones that are plant-based?
Okay. Yes. Great question. And it allows me to take one angle, okay, because I can come at it from different angles. So in this process of developmental medicine that I started, early on in the practice, understanding that there's stages. I've broken down these stages from 0 to 3, 3 to 7, 7 to 11, 12 to 23, 23 to 36 to 37, 37 to 43, 44, 44 to 48, 49, 49 to 56, 56 to about 65, and then 66 to about 77, 77 to 84, and then on from there. in each stage, there's different things that are needed, okay? As specifically as it relates to diet, but it's also related as an individual because there's a developmental aspect as well as a physical aspect. There's a mind aspect as well as a physical aspect. So the idea, Pat, in answering your question, it depends on the age, right? And if you're going to talk about now the aspect of sarcopenia, yeah, that starts to kick in, really starts to kick in at 50, okay? And that's when the enzymatic changes really start to become paramount. So that's why between 43 and 48, that's what I call the investment period. That's really critical for making sure you're taking stock, making sure you're making certain changes and preparing for the second half, because the first 50 years are preparatory and developmental and nurturing years. The first 40 years, 40 to 50 years. After that, from 50, okay, on up until 90 and beyond, if you make it that far, okay, is the wisdom years, where now all of that nurturing, all of the elements that have gone in on those first 50 years, especially different in different segments, okay? First 3 years of life establishes 90% of a lot of things that you really learn in life, okay? And then you learn how to correct stuff. But the idea is that there's going to be different nutrition, okay, for different stages. That's the first thing I want to say. Now, the next thing is that, yes, if we want to talk about that 50 period and beyond, we must be more careful with a critical nutrient, which is protein, amino acids, because our enzymes start to change and start to wane, and you start to get into senescence and start to get into genetic susceptibilities. That doesn't mean you have to eat animal protein, though, okay? It's because the reason why most people need more protein, Pat, you know the reason why people need more protein? Pat?
That's for directly, I mean, primarily tissue repair, yes?
Well, that's the result, okay? That's the result.
Right.
But the reason why people need more animal protein is because they eat too much sugar, okay? And sugar, think about what sugar does on the cellular level, okay? How many enzymes is required, okay, to take one molecule of glucose all the way through to the Krebs cycle to generate energy? It's a lot of work. Now, if you're depleting and you're constantly, okay, over the years, because we are consumers, and there are those who know that the things that sell food is going to be the smell of fat, okay, the taste of sugar and fat, and it's going to make sure that you are eating foods that appeal to your brain, okay, most of which, or your brain in terms of your eyes or your smell, or even how it tastes, right? So that's been manipulated, okay? It's been manipulated to a huge degree. So now when a person gets to be 50, okay, there's not been nurturing, there's been tearing down, okay? So that's part of the issue. Now, in terms of the simple question is, yes, people need more protein. After age 35, they need to be careful with making sure they get the protein intake, and especially in American society. There's another reason why we have such a problem, okay, with our nutrition. It's because of what's added to the food. And that's another thing that I'm going to have. And in December, Omar, I'm going to come back and I'm going to break this whole piece out to understanding how, if you really are interested in taking care of your health and you understand that food is such a critical piece, you're going to have to understand all of the hidden dangers behind that are in all the way across the board. I don't care what diet you have.
I look forward to hearing more of that discussion from you, Kevin. When you said you'll be coming back in December, because while as physicians we can recognize the veracity of what you're saying, and we have adequate statistics to show the effect of plant-based diet on improving certain health, and in my field, especially in cardiovascular health, I have no objection to that statement. The problem we have is in encouraging patients beyond the age of 55. You mentioned the changes that occur with them. That encouraging patients to really change a diet that they enjoy, that they become accustomed to. How is a mammoth task to get these changes in patients once they reach a certain stage of maturity? I can give an example of one that I encountered that we sometimes are able to convince patients of, and that is, of course, the dangers of cigarette smoking.
Right.
Where we have adequate statistics now to show that if a patient is a cigarette smoker and has had heart disease, that if you should stop cigarette smoking for a year, we can reduce the incidence of new heart attack, for example, by 50% in that 1 year.
Yes.
And after 10 years, if they stop smoking entirely, then they're reduced to the level of risk of non-smokers.
Yes.
But I mean, that may be a little more startling and something we can hit our patients with to encourage them. But you must have a tremendous task in terms of encouraging dietary changes from foods that we love.
Yes. So that's
Dr. Ackley, it's funny. I'm gonna let you go for a second, Kevin. And then what I think when you talk about making adjustments, people try to mimic what they're used to, right? So now you're trying to have a plant-based diet with a plant-based meat-like substance. But to get it to that point, it comes with a lot of additional things that you put in that are not necessarily good for you, right?
Right.
Yeah.
Right. Yes. So those are the things that I have to entertain. And that's what I'm talking about, that there's so much behind the scenes in terms of if you're going to use any particular diet, because people don't understand just because you're vegan or just and you're eating textured vegetable protein or you're eating beyond meat, there's process and there's elements that have been added to that has its own downside, or the salt content increases exponentially, right, Dr. Elderly? Okay, in these foods.
Yeah.
So I do want to say this, okay, that Dr. Elderly pointed out, okay, which segues into that there's five or six things, okay, that are general things, general categories that will increase longevity. Okay, one is I will say for people who have increased longevity, okay, because it's not quitting smoking is going to help, but never smoking is what makes the difference. I just want to make that clear, because sometimes people think this because they should quit smoking because it does increase cardiovascular, does increase cancer, does increase lung problems, etc. But just because once you quit, you still have to do things because those residues are inside and it continues. Okay. And people then say, well, I quit and I still have COPD. Okay. But there's reasons for that, right, Omar? So
there are reasons, that's for sure.
So number one, I need to be clear. Okay. In terms of these 5 or 6 things, okay, this never smoking is what it has a direct correlation to longevity. Okay. That's number one. Okay, number 2, definitely regular physical activity, 30 minutes a day, 5 days a week, correlates with longevity. Okay, that means you can't start, it's going to help you when you're 50. Okay, and yes, you got to implement that when you're 50. But again, the earlier you start, the more it increases the longevity.
Now, Kevin, with the physical activity, you don't have to go to the gym and lift barbells.
No.
We're talking about things like walking.
Yes. I'm just walking 30 minutes a day. Okay, just walking, nothing else is going to increase.
Absolutely agree.
Okay. The next thing is a healthy weight. Healthy weight is correlated with longevity as well. Okay, clearly indicated and indicated. Second thing, no, this is the third, right? So we got
you have to 4.
From 4 is alcohol. Alcohol, again, drinking of any degree has its negative impact. Drinking heavily takes years off your life. Period. Okay, alcohol abstinence is going to increase. Even if you were a drinker and you stop, you're going to increase your longevity. Okay. And healthy diet. A basic healthy diet comes back to your point, okay, which is number 1, balance, just balance. You can have flesh protein, okay, and you have to have vegetables. You have to have some green leafy vegetables. You have to have whole grains, okay. You keep the dairy to a minimum because you don't really need it, okay. Except if you're vegetarian, then get the best cheese. Like there's a raw goat cheese. There's a raw milk cheese. Okay, get it because it has more vitamin K, has other elements in it, okay, that are going to assist, So there's different little nuances, but those are kind of the 6 things. The last thing I want to mention, okay, which is the trump card. And is also the reason why, unfortunately, African American black male has the lowest
longevity.
Lowest mortality. Has the
Longevity.
That's the lowest degree of longevity and the highest mortality.
Mortality.
Okay, for the average American, we're at this point about 85 to 86 years. Okay, for the African American, okay, and that's skewed because the female is always more. Okay, so the average male is I think about 81. The average female is about 86 or thereabouts. And then we have the lowest, okay, African Americans now drop down to 75, okay? And the male is at 70, okay? So stress, and they know that.
Oh, we lost Kevin there. We lost our connection with him. Hopefully he comes back in. And he hit an excellent point as far as stress is concerned.
But Omar, stress is interesting, right? Because I often say, why pressure treated lumber doesn't rot? It's been pressure treated, right?
Hello?
So stress. Oh, here you go.
There you go, Kevin. We lost you there for a minute. You were talking about stress.
Yes.
That's when we lost you.
Yeah. So stress is a given aspect of life. We need to understand stress as the opposite to the relaxation response. We all have stressors. If we become stressed, it means that we have not learned how to mediate the stressor. Okay? If we take out infant mortality out of the picture, okay, for the general population, if we take out infant mortality, then the actual age increases, in the mortality age actually increases for the general population by about 5 or 6 years. For the African American population, even though infant mortality is higher, the actual mortality rate only changes by 1 year, a half a year. So they've looked at the amount of stress that the population has had to go through and realized that those environmental pressures, okay, over time have had this stress response, biological stress response, that has been highest on the African American population, okay, and highest on the African American male. So it is important for everybody on here, okay. Thank goodness, because you are on here, you're already are doing things, okay, to meet it, but you need to increase that. You must work with breathing. You must exercise, because exercise is an automatic stress reduction, okay. You must make sure that proper sleep, okay, is obtained. And I know I have to counsel myself on this, okay, because I'm up late doing a lot of things. So I just want to emphasize the importance of those three factors that I mentioned before: genetics, environment, and lifestyle. That environmental pressures, genetic constitution, and then your style of life is the mitigating factor. And there's many things that can be done, okay, to enhance the longevity, which again I will talk about in detail whenever you wish.
All righty, we're going to get you back now. Okay, so this is how we're setting up. We have about 10 minutes to go. I'm willing to go over a little bit so we can get some of these questions answered. Dr. Court, your hand is up, and then Dr. Patrick Anderson. Let's go, Dr. Court.
I always encourage my patients to walk.
Yes.
And some of them said, well, I can't walk because I have to go to the park. And I tell them, you can walk right in your house. You do not need to leave your house to walk.
Very good.
Do you agree? Is there any difference in walking outside and walking inside?
Yes, there is a difference. Okay.
What's the difference?
The difference is that there's the nature component, okay, the wind component, walking against, okay, that, and also the air itself has an effect. Remember, I said it's also not just the walking, it's the effect of walking on the breathing, the effect of walking obviously on heart rate, the effect of walking on the coordination, and the effect of walking on the brain. Okay, so when you're outside and you're walking, your view increases tremendously. Okay, for the most part. Okay, so that has its own benefit. But short of the other little details, walking in the house, even if you walk in place, okay, it's going to make a difference.
Mm-hmm.
And if I might comment, walking is like nutrition, right? They're your basic nutritional components, your carbohydrates, your proteins, whatever. So when you walk in the house, you're focusing on increasing your heart rate, getting your muscle tone right, physical strength up. When you walk outside, there is those unrecognizable benefits, right? So all of a sudden, your vision, your visual cues, for example, becomes expansive, right? Without you even knowing it, because now your depth of field is deeper than your four walls, right? Now your adjustment, your light adjustment, your eye muscles adjust to contrast and various intensity of light, which is more inconsistent with what you see when you're just in the house. So those are some of the added benefits. Some people call it when they walk in, when they go hiking, especially in the forest, they call it forest bathing, right? Because there are all those other environmental cues which doesn't happen in a controlled environment that you encounter when you're out there walking. And that does improve your dexterity, your balance, and your orientation in space.
But you can get
But
robbed when you're outside.
yeah, right. Yeah. But what I have Dr. Holder's attention is we tend to focus on what you do with management of physical ailments. Um, how do you manage holistically mental health, and especially those diagnoses that fits the classic? Now, I guess you have like DSM-15, the psychiatric book of diagnosis, right? For example, paranoia, schizophrenia, those kind of things. Is there a complementary slash holistic approach to management?
So the short answer is absolutely. Absolutely. And because I'm flipping between mind, body, body, mind all the time,
Right.
I had to look at this in detail, okay, because I get patients with psychiatric disorders as well as physical disorders. And for me, I don't necessarily look at them as different because I'm doing it from a holistic perspective, okay? So when I'm dealing with a patient, I got to see what I need to do biologically, okay? I need to see what I need to do sociologically or psychologically. So there are approaches. There's actually nutritional approaches to some of the extremes. Okay, the extreme diseases of the mind or brain, schizophrenia, that's going to require drugs most of the time. Okay, but I will say that there is a mega nutrition. Okay, that sometimes can be of help, and sometimes just changing certain elements. For example, some patients with schizophrenia have a casein problem. Okay, so there's certain select foods that can really disturb the brain and cause a break in regards to the normal chemistry of the brain. Depression, certainly diet can have a tremendous impact on that. Anxiety, okay, anxiety just related to blood sugar management. Okay, for a person not hyperglycemia but hypoglycemia and having a tendency for this effect of sugar in some people can create this anxiety that they're not even aware of. And it's oftentimes because the rate at which the blood sugar changes. So again, just like you elaborated on the other comments with the exercise, there's much more that could be said, but in answer to your question, unless you want to ask me something more specific, yes. Yes.
Excellent. Dr. Court, your hand is up.
Really, yes. Really, as a take-home lesson for today, what does a holistic physician do? When do we need to say refer a patient to a holistic doctor?
Okay. So that's a great question. Like I said, answer it in a couple of different ways. One is when you're stumped.
Good. Okay.
Okay.
Great
All right.
start.
That's
Great start.
Because
But
usually when you're stumped, it means that it's outside the textbook. Okay. And when they come here, the textbook for me is them. Okay. If you understand that. Okay.
Right.
All right. So that's one. The second thing is, and that takes into account a lot of stuff. Okay. The other one would be if the patient, you find that their nutrition, they're not paying attention to their nutrition and they're having problems with their particular disease process. Certainly, we can help with that. With certain conditions, certainly with diabetes, we can help with that. Hypertension is a tough one. Okay, hypertension is multifactorial, right, Dr. Athley? I mean,
Right.
It's not just cardiac. It's not just vascular. It's nephrological. It's central nervous system and input, on the heart. It's endocrine, and even has a relationship to digestive hypertension, and it's got a genetic polydisposition. So hypertension is a tough one, and it's got a developmental component, as I was mentioning, because of, especially in the African American population, because of the aspect of this imprint of trauma, which is thereby a biological response is activated, where both the hypothalamic pituitary adrenal axis has kind of taken on a life of its own, okay, that's necessary to even maintain. A lot of people with a blood pressure of 180 over 100 feel great.
Yeah.
You lower their blood pressure and they feel horrible, okay?
Mm-hmm. That's true.
All right, because there's a certain adaptation that's taking place. So hypertension is a tough one. We certainly deal with them from a mind-body side, okay, because of this element of trauma. If I can adjust them to understand themselves better and things that they're really not processing, then that oftentimes can lower. And then there's certain breathing techniques that we do with that as well. So that's a couple of things. But I guess the first place is if you're stumped, okay, then send them over and we'll collaborate.
Well, but an ounce of prevention is better than the cure, right? So
yes.
should we start sending them over
Oh, yes.
at the outset, so we can have a broader platform from which we can, isolate our individuals' input?
That's a great point. Pat. That the reality is prevention is the best cure. As I mentioned before, let's not wait until after you start smoking. Let's get people understanding how to use their breath to their advantage, okay? And also realizing that certain foods are going to reduce your risk dramatically. Certain basic things that we can talk about, and then there's other very specific things, like fiber, okay, in a cardiovascular patient. Number one, top, off the board. Because I know if I can get that patient to eating 35 to 45 grams of fiber, that I know that they're going to be better. You know why? Because they got to eat more plant-based, fiber, phytonutrient-dense foods.
Mm-hmm. Yeah,
I think that the secondary, or if I may just add, I think that secondary prevention is the sort of thing that I would certainly welcome your help. If a patient has already had a heart attack or a major cardiovascular illness, I think they'd be more attuned to the need to do something a little different.
Yes.
And therefore, that might be certainly more acceptable in terms of following your advice.
Yes.
So that sort of approach would help tremendously in these kind of patients.
Yes, very good. Yes. So that's a great point.
Kevin, there's a great commercial where the guy looks at the caricature of his heart and said, "Listen, they have me eating kale."
And now, by the way, I told you we're gonna close out here, but I told you that I don't recommend kale anymore. Okay.
Oh, really?
Yeah. Now kale. I mean, listen, I've used Power Foods since the 80s. Okay. I can't do the same thing. Kale's one of the foods I can't use. Now you're growing your own food, so
right.
Okay.
Right.
So
Hey,
that's a different story there. Okay, we have to
yeah,
talk. We got to talk.
Let
yeah.
me do
Okay.
this. Listen, guys. We have questions that before this show is over, we're going to answer these questions because we got quite
All
a
right.
few of them. So let's get going with some questions. Um, Dr. Holder. Okay, what is Dr. Holder's view on vaccines? All righty. Which does he think are really necessary and are effective? So, Kevin, we're going to keep our answers short because we got quite a few to go through, and I don't.
Well, this is a real short answer.
Okay.
It's a real short answer. I can't answer that question.
Uh-huh.
Okay. That question is a question between them and their doctor, okay, and their household. Because number one, vaccines from a pediatric standpoint is mandatory. It's mandatory. Okay. So, in terms of an individual's choice, that's a different story. So.
Okay. All righty. Yeah, because and I agree with you on that, Kevin. It's an individual's choice. It's a family's choice. There are the literature states that certain vaccines are effective. That's true, and like smallpox and there's so many things that we don't come in contact with as physicians today is because the vaccines at this are available and are used. So I agree 100%. It's a family.
But so with that, so the issue is, Omar, is Dr. Bay, is that
Omar's fine.
is that they're asking a question,
which
vaccines to take or to not take, or which ones are recommended or not to recommend. Okay. Right. So that question in and of itself, okay, it's not a matter of, you're asking my professional opinion, my personal, what is they're asking, So that's a tough question to answer in this kind of framework.
Yeah, this setting. Yeah, I understand. Second question. Let me read these for you. Alrighty. Can Dr. Kevin give some examples of holistic medicine reversing some illnesses, example, such as if he has prescribed sleep or acupuncture or more hydration, etc., and it has helped the patient? Every human's body is different, but examples are helpful.
Okay, I probably have a few pages on here to give some examples. So we just by altering the sleep cycle, we've been able to help some hypertension patients, okay, and lower the hypertension. So that's one. And your sleep medicine, Omar, so you know this, okay. They're in terms of obviously in terms of patients that are overwhelmed, anxious, etc., addressing their sleep oftentimes can also be of help. Now, in terms of other things like cardiovascular, the idea is that there are foods, I'll give one as an example, that can have some impact on vascular resistance and thereby heart health. And that's just plain beets, as most know these days. So beet and celery, as long as you get it organic, okay, can have it direct. And I've had many patients that have had blood pressure issues. We've also been able to reverse their coronary calcium score, reduce their coronary calcium scores by a diet. We know that the Pritikin diet from way back when, okay, has reduced cardiovascular atherosclerotic disease. In terms of asthma, irritable bowel, even inflammatory bowel. Inflammatory bowel is a tough one, but we've had cases where we've been able to use nutrition as well as some homeopathy to reverse. I've had kids who've had ear infections, kids who've had bronchitis, and kids who've had even some eczema conditions where we gave a homeopathic remedy and it changed dramatically, quickly, resolved quickly. So these are just a few examples of some things.
Excellent. Let's go to the next question. It says, how would you discuss the autoimmune system its attack on the body? And you just mentioned some of them right there. Go ahead.
Yeah. So the the autoimmune is a huge category nowadays with the biological, injections. Tremendous response in some lupus cases, some rheumatoid arthritis cases. So medicine has come a long ways in dealing with autoimmune beyond just the prednisone approach. But that's all based upon what's done to you versus what you're able to do to really help yourself. Okay, so in terms of autoimmune, there's all kinds of reasons why the body turns on itself, and we have to figure out why. And it's not easy to always reverse that. Okay, it's even more difficult now. Okay, because one of the reasons why the body is turning on itself is because just simply of the food that we're eating, and not even talking about the bad food. I'm just talking about food in general, because the body is cross-reacting to compounds. Allergy, basically. An autoimmune process is an allergy to your own body. Okay, the body is attacking certain parts of it. For example, with the thyroid, most of us like pasta, like bread, but the bread in the United States is one of the worst grains in the world. Okay, and because of that, it's kind of been adjusted from its natural state, and there's too much bromine, okay, that is ingested when you're eating too many flour products. Well, guess what? Bromine is in what category of elements? It's a halogen. It's a halogen. It gets absorbed by the thyroid and inhibits the thyroid function, and sometimes causes the body to recognize the thyroid as foreign, and then we get these TPO antibodies or anti-thyroglobulin antibodies. So in answer to your question, in terms of autoimmune, yeah, you can use diet to a large degree. You got to do some basic things. You got to understand the stress response and reducing the stress response in the body. You got to look at one of the key ways to doing that is by being in sync with the biorhythms of your body. Proper sleep, proper timing of sleep. Sometimes even during the day, getting recumbent right before 4 o'clock because of that extra cortisol surge, so you can mitigate that so that you don't get too far out of rhythm. Okay, and then the use of breathing as a tremendous technique to assist with maintaining the body's integrated space versus this autoimmune, which is a disrupted space.
Excellent, excellent. There are some more questions here, Kevin. That was excellent. This is a long question, and hopefully, Patrick, you're still here. I don't know how much we can help this particular person, but let's give it a try and at least give her some comfort here. I'm a 74-year-old woman fighting vulvar cancer for over 10 years, and the wound is open and fresh. Is out extremely excruciating to move. The mass has gotten larger per the CT scan in the hospital yesterday, and 10 more eye-sized tumors have developed over the last month. I have clots that said they can't remove because they are on the mass lymphatics. It's a lymphatic problems. Legs just blew up. Okay. Let's see now. Let's see where with fluid. She's on oxy. She's on diluted oxygen, antibiotics, etc. I take frozen
soursop.
soursop, fruit smoothies, juicing, There is there anything that I can do with herbs and naturally, since no longer, I guess, chemo or radiation? What can I do to help myself? So this is a situation which I feel that she has metastatic disease. And Patrick, I'm sure you deal with this all the time. Can you start off, Patrick, and then Kevin can come in,
Yeah.
possibly?
I think she's saying I no longer want chemo and radiation.
Mm-hmm.
When I hear this, when I see this, I have to assume that she's had some This is an advanced disease, and she has had some intervention, whether it's surgery plus or minus chemotherapy and radiation. And without knowing specifically what she has received, it gets difficult to make some recommendation going forward.
Mm-hmm.
However, I might say one approach is similar to what we briefly talked about, Kevin. When we talk about an immunochemistry approach, if she's that far along, there are certain genomic markers that if we know what they are, we can make some recommendation as to some of the immune checkpoint inhibitors or some of the other targeted agents that she may potentially benefit from, right? But
Yeah.
that speaks directly to the disease itself.
Right.
But some of the other sequelae are things that happen as a result of the disease. The swollen leg. The question is, why is it swollen? Is it because of obstructive lymphatics? Is it venous compression? So hence blood doesn't return well from the leg. Um, 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 that's one aspect of it. From a general perspective, is this 74-year-old someone with heart disease who's now further debilitated by the disease, and as such, her cardiovascular function has deteriorated as well. Um, the fact that it's an open wound, is there an element of colonization, meaning with a bacteria, or is there infection that's causing significant inflammation and as a result swelling? All of which, is hard to assess just by reading the story, but
Mm-hmm.
can surmise that there is a combination of all of these elements, right? And it sounds to me that from a surgical perspective, this is too advanced to the point where surgery would be beneficial without something that's, exenterative, or whether she would even meet the criteria for an exenteration, that kind of an approach. And all that is, it's just removing essentially everything in the pelvis, including the diseased area. Um, um, so, pardon me. So I would take a more of an immunotherapy approach to this, plus or minus combination with chemotherapy. Um, One of the other things that may or may not be helpful, depending on one's perception of the condition,
Mm-hmm.
is to seek out enrollment in a clinical trial,
Mm-hmm.
right? Because there are major institutions that are looking to combine um, 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 newer agents with conventional agents, immunotherapy with chemotherapy, immunotherapy with different immunotherapy, other targeted agents combined with other targeted agents that could potentially be helpful.
Mm-hmm.
So it would serve me well if I have those records in front of me to see exactly what's been done in the past.
Excellent. Excellent. Thank you, Patrick. Kevin, did you have anything to add to that?
So I would certainly follow Patrick's lead. There's a few things that this my heart goes out to you, okay, and
Yeah, yeah.
I wish you as much comfort as can be mustered up. Please do go deep within yourself, okay, to this where this whole mind body piece comes in,
Mhm.
to understand that you are still well despite this. Find the most well aspect of yourself. Not easy to do, obviously, but you can use your breath to find that spot, and allow your body to unleash these mediators that can actually assist not only with pain but can also assist with the inhibition of the tumor, which I'm not going to get into the details of, but just trust me and just practice 6-7 times a day. Just be still and just find that spot. That's one thing. The other thing is that um, obviously there's, in a case like this, I would safely say, not that it's going to make like a difference in terms of this cancer, but in terms of the healing and the capacity to assist, you should make sure that you're taking vitamin C on 1,000 milligrams 4 or 5 times a day. It shouldn't hurt you. May not help that much, but it's something that I will recommend given the severity of what you're dealing with. Okay.
Yeah.
Again, you got to pass this through your oncologist, okay, to make sure that it's okay with them. The other thing that I would follow your lead on, Pat, that I think in this case would be important is I would go with very high dose, which is one of the things that researched lately. High dose resveratrol, 400 or 500 milligrams twice a day. Start off with 200, increase it on up to 3 to 4 to 5. Again, run it through your oncologist, but that has some direct effect on the tumor, and it also has some effect on the wounds. The last thing is as for your own energy and capacity, is a green twig tea, a green tea or bancha tea, okay, that again should not interfere with anything and may be of some help.
Mm-hmm. Excellent.
Yeah, and if I might just say one thing quickly, obviously, if patients are doing well, that's a different conversation. But for example, without disclosing or violating anyone's privacy, Dr. Holder and I have taken care of multiple patients with advanced cancer disease that I can honestly say through the conventional means, I know we weren't going to be able to quote unquote cure them. But if I tell you with his help, the quality of life that these patients got just through the collaboration was immense. So everything he's telling you has significant value.
Mm-hmm. Excellent. That's thank you, Kevin. Let's go to the next question. 79-year-old male, and the doctor has put me on cholesterol medication, which I believe is genetic in our family. And now they say I'm borderline diabetic and has put me on the medication for that. I walk every day about 1 hour and eat salmon as well as oatmeal every week and eat night. Okay. And
Eat
at
right,
night.
eat right.
Oh, eat right. I'm sorry.
Yeah.
One of these days, I'm going to change my glasses.
You're doing all right. You're doing all right.
What else can I take besides these medications to help myself? Okay. Yeah. Well, the thing of it is yeah, I know I do as far as weight loss is concerned and diabetes. Understand pre-diabetes. If he stated he had a borderline diabetes, I don't know if he's talking about pre-diabetes. It all depends on his hemoglobin A1C. But pre-diabetes should be, and the literature states that it's curable with weight loss and exercise. So I want to let you go on with Kevin, and as far as the other things. What exactly can he do as far as the cholesterol and maybe helping out with the diabetes?
Well, first of all, you're absolutely correct. The basics of exercise, weight loss, getting at that ideal weight, is the first step. Not all the time does it work. I wish it did, but still is the first step. Now, this is where I would bring in Dr. Athlete. He's still on. Is he still on?
Yes, I'm here, and I
Okay.
want to add a point to it as well.
Yes.
If you wanted me to. Essentially, the patient is 79 years old. He mentions that he has elevated cholesterol, which required medication, or we are much less aggressive in terms of treating cholesterol per se, just the number, just the fact that the cholesterol level is elevated in patients who are elderly. I would like to know if he has underlying other risk factors for coronary artery disease, other things that would predispose him to having heart attacks or blockage of the coronary arteries, for example, or if he has some symptoms, something that promotes the need or suggests to me that we need to control this cholesterol more aggressively. So I would not automatically or routinely do that. We'd like to know how it is, and I certainly would have the benefit of Dr. Kevin Holder's opinion in terms of what we might do from a holistic viewpoint, what we might do short of medication to help bring this cholesterol down rather than start off with medication.
So that's great. So that's the collaboration, okay, that you need to have. What you just heard, your cardiologist should be speaking the same thing. That's why the first to Dr. Atherley, a seasoned cardiologist, seen many patients, and understand that's not a knee-jerk process, okay? That cholesterol drug, okay? That you got to take into account the patient's age, you got to take into account the patient's risk factor, you got to take into a patient's personality, you got to take into account the patient's history, okay? And then we can come, okay, once he, has looked at that, okay, and he comes to me, now I can take that case and now put it in perspective, or we can network between him and myself and say, okay, well, what's the coronary calcium score? What's the LPA? Okay, what's the level of LP little a, that is? Okay, what's the ADMA? To look at what's happening with the actual vasculature, because it's not about the cholesterol. I'm so glad to hear you say this, Dr. Atherley. So many cardiologists, are so programmed statin, cholesterol, statins, more statin, drug, cholesterol, etc. When, we know there are people who have heart disease whose cholesterols are normal, okay? Coronary artery disease is not simply a straight cholesterol problem. This is the holistic approach that's been going on for years, that now hopefully most are coming to grips with this, okay? So I would work with, say, the cardiologist, with Dr. Atherley, someone who's right-minded, to say, okay, what needs to happen is we need to look at what's happening with the endothelium. We now have ways of being able to look and assess this. I even have a test in my office that's able to look at the endothelial. Once we understand that the endothelium is affected to a large degree, obviously if the calcium score is high, then we already know that, okay? But that's heart plaque, okay? Now we have to deal and understand that it's not the heart plaque. Heart plaque actually is protective, okay, to some degree, okay? It has other problems in terms of potential stroke, but the idea is that we want to minimize the stickiness of the blood. So we don't have to go to a platelet drug for that, okay, which might prescribe. You can go to nutrition for that. And then we can also go to the ability of the body to absorb some of the plaque, okay? And that's where the nutrition comes in. Something as simple as a high quality olive oil to protect the blood vessels because of the polyphenols within the olive oil. It has to be the right olive oil. Colavita is one of the ones that I recommend brand-wise. Most of them are not high enough to really make a major effect, but that's going to assist with platelet aggregation and the inflammation that happens when you get platelet aggregation. So we can not focus so much on the cholesterol, okay? We want to focus on the risk of a heart attack or a stroke, and then we can start to design the program that's going to improve your quality of life, okay? That's going to improve your morbidity and mortality based upon understanding your body, and what your body's doing. Remember I said at the beginning that I went into medicine to help people. That means I have to understand the body and I have to help the body. Given a statin drug, it has its benefits. But let me tell you the reason why it has its benefit, okay? Because statin drug, okay, comes from, everybody, I think most know this because I might have said it the last time. Not sure, Dr. Atherley, if you're aware. It comes from a natural substance, okay? Anybody aware of that? You know where it comes from?
I'm not sure.
It comes from red yeast. It actually comes from red yeast.
Red yeast is a form of a statin.
No, the statin comes from red yeast.
Is it?
Yes.
I thought red yeast was a form of a statin also.
No, that's the thing.
Okay.
Is that they isolated. What was happening was that red yeast was lowering cholesterol.
Yes,
the drug companies said, whoa. We might be able to make some money off of this. Okay. They studied it 25 years ago and found that the statin, okay, is an actual component of red yeast. They extracted that and they then made it. And now, of course, the statin drug is a $1 billion industry. Okay. Now, the reason why the statin drug is important, it's an HMG coenzyme inhibitor, but the real aspect is because it reduces inflammation. There's an anti-inflammatory component, to the statin drug, and that's what has a tremendous impact. So, in any event, the answer is that yes, there are answers, there are ways, and we work together collaboratively, and there's lots of things that can be done to assess risk and also deal with the cholesterol. Now, the last thing I'll say on that is, number one, all across the board, without even knowing the case, I'll make this recommendation, but still run it with your cardiologist, primary care physician, because you have to still do it correctly. You just have to increase your fiber to 45 grams per day. 45 grams per day. And there's ways to do that. There's specifics about that. So please don't run to do it without guidance. But, that's for both you all to understand and also for this patient to understand.
You said fiber, Kevin?
45 grams of fiber per day.
Fiber, yeah. You know one thing, I'm going to tell you the truth. In the ICU, one of the things that when making rounds every day that we ask, did the patient have a bowel movement?
Yes.
You can be a simple thing like that. Yes. It is like before we go on to the next patient, did they have a bowel movement? And if they didn't, we're going to start medications or whatever we have to do to get them to have regular bowel movements.
That's
because these are critical care patients and they have to have daily bowel movements.
Yes.
Number one. and the healing process is truly associated with that.
Yes.
Number one to one.
Yep.
I'm going to tell you something as simple as, and it's a simple concept, but healing, as you say, it's a holistic approach.
Yes.
All righty.
I have one question.
Yes, Dr. Cord.
This is a 79-year-old male. Are you sure that he did not have cholesterol issues before? And if so, what was it? LDL that was elevated? What is this LDL level? And if not, maybe Dr. Athlier and Dr. Kevin can tell me, well, what conditions or what would prompt you to develop high cholesterol at the age of 79?
Oh, no, they've had it. Undoubtedly, they've had it. They said there was probably a...
right, no question.
Yeah, they said that they had it. Yeah, they didn't just develop the cholesterol at 80.
No, there's no way. No.
All right. We're going to take one more question because we're well over our time. Okay. Kevin, hold on. Oh, why don't you recommend kale? That is our last question of the
day. Because they've adulterated it, and now it is unfortunately that plus another one that's really good, but is filled with pesticides.
I'm sorry, we didn't hear the last part. Filled with
pesticides.
Pesticides,
yeah.
Filled with pesticides, and also people's bodies have a hard time processing the kale. It's a great, it's one of the most important. I used to do this blended vegetable mixture, kale, carrot, and celery. Okay, did that plus a lot of other things for patients and a couple of different, whether it be hypertension, some coronary artery disease, and even some cancer patients. I can't do that anymore because the food is actually now got other elements, that are contrary to the benefit. Now, getting it organic is better, but it still doesn't solve the problem.
So if I might ask you, Kevin, is that based on just the way the crop is grown, or if you grow your own kale from seeds?
So if you grow your own kale from seeds, that's why I said, Pat, you got the answer, is that you're going to mitigate that. Okay, you got to make sure you test your soil. Okay, because the soil that you get also is contaminated.
So one of the things I do is, unfortunately, it's only about 30% of the soil that goes into our garden every year is what we compost in the backyard just from food scraps and so on. but obviously that's not enough to replenish the grow boxes. And we grow outdoors during the summer, indoors in the greenhouse during the winter. But like everything else, you have to keep replenishing the nutrients. Now, I see my wife came up with this great natural fertilizer, Kevin, where she takes eggshells and she powders it up with coffee grounds and she makes a tea, which she puts it in water for 24 hours and just blow air through it for 24 hours, strain it, and she's getting great results.
Oh, wow.
Yeah, so yeah.
I love it. I
So
love it.
so she just put Miracle Grow on notice.
Oh, great.
I got you. I
Yeah.
got
Yeah. Yeah.
Calcium is
So,
a really
information is out there. A great topic, Omar, is, that we could have is to start talking about how artificial intelligence influence what we do.
you. Yeah.
But like everything else, there are advantages and disadvantages. A lot of information is out there, and it's up to us to get it, summarize it, and figure out how we can use it
Right.
effectively. I sometimes, Kevin, question the use of kale and spinach based on certain chronic medical problems. Like if you make oxalate stones, for example, you need to be mindful of your consumption there.
that's only not for kale, for spinach.
Or spinach, yes.
And the spinach, generally speaking, if you're eating, just so you know, Pat, if you're eating raw spinach, the body doesn't have the same effect. The oxalates do not have the same effect if you're cooking it. Once you cook it, those oxalates become a major problem.
Yeah.
All right. The thing of it is, and I always use the ketchup bottle as an example for what we eat here in the United States.
Yeah.
Our what's allowed in our food is not regulated as well as other parts of the world. For instance, if you go to Europe and you pick up a ketchup bottle, I mean, you'll see how many ingredients is in it. And then when you come here and pick up that same ketchup bottle from the same company, the ingredients are about 3 times as much.
Yes.
So, the thing of it is, our food source here in America makes it very, very difficult to be healthy.
Yes.
And so that's one of the things that and especially with our community, with food deserts,
Right.
and not having the appropriate grocery stores and not having fresh fruit and vegetables to choose from. Boy, that makes it very difficult for our community to stay healthy, be healthy, and even raise your kids eating the right thing. I mean, it's very difficult. So we understand that, and just trying to do as much as we can to solve the problem. Any Dr. Holder, give me last words. Just a few words that you feel are important that people should hang on to from what you stated today.
Number one is CEO. You're the CEO of your health. Don't forget it. Nobody else runs your business except for you. Okay. Your doctor is your partner. Okay, is your advisor, is your assistant. Number two is health is a gift. It's up to you as to whether or not you treasure it. Okay. Number three is that you must understand that you are a biological miracle with so many chemicals that are being produced, waiting to be used to your advantage every single day. Take advantage of the fact that you have 20,000 breaths per day to now use to release all the negativity, as well as to absorb every ounce of goodness that you can. So this not only does your breath serve you physically, but it also serves you mentally. Okay, understand that you have to re-engineer. The older you get, you have to be more wise. And it's your responsibility to accumulate. If you haven't accumulated, to get to somebody who is. And obviously your doctor is supposed to be part of you getting increasingly wise about how your body works and about what your body's up against. So those are a few pain points that I think are important. And I want to thank you again, Omar, for having me on, and thank you, Pat and Trevor and Kevin, and Dr. Anderson, Dr. Bay, Dr. Atherley, Dr. Clark. Thank you all for having me.
Excellent. We appreciate you coming on, man, because you're a wealth of knowledge, man. And the thing of it is that our community is, my parents come from the South. I mean, we did my mom and pop had so many holistic remedies in the house. We have so many patients that are from the islands or from Africa, and holistic medicine is a part of what we do, man. Just in our homes. So talking to someone like you and having that avenue that we can send our patients to is critical as far as I'm concerned, especially for our community. So
let me ask you something. Let me ask you. You're from down south? South Carolina? Was it? Where is it?
South Carolina. Both my parents are from South Carolina.
You still have land down there?
Actually, we do, but I'd have to talk to my older brother is where it is.
Oh gosh. Okay, because let me tell you, for anybody you're associated with, that land is so important because of the issue of health and food in America. So that'll be in the next time we talk, and I'm going to lay all that out, in terms of what you have to use as your resources to your advantage.
And I might say, Kevin, while land is important, use the space around you.
Yes.
There's so many ways we can do, urban farming.
Yes.
Is an option. Yes. And you don't need a warehouse. You can do some good things just inside your kitchen.
Oh
right?
Yeah.
You just need a little bit of space.
I want to affirm that because we were talking about food deserts. There's so much now in Newark and Essex County in terms of farming and foods and in different places that you can get food. People just got to search it. This available now. Okay.
Yeah. And if I tell you, I was at an event at the Newark Library last summer. I met a young brother. He has a bee farm in Newark.
Yeah.
A bee farm.
Yeah.
He had honey.
I know what that is.
He had soap. He had all these products. A bee farm in Newark.
Yeah. And also, I want to tell you, for those out there, on Facebook, there are the Facebook group called Black Farmers. And it really, really is, brothers and sisters going down south, getting land and growing their foods naturally, and they're doing great jobs. It's Black Farmers on Facebook. Yeah. All right. So I think this is wonderful. I'm just going to thank each and every one of you for coming on. Boy, it's a heck of a show. I want to tell you, we went over 40 minutes over. How do you like that? I think this is the first show we've ever gone over that long, but it was a joy. It was a joy. In closing, our closing remarks. Okay, I'd like to thank OBHealthy for allowing us to bring this webinar to you. I gotta always thank them for their platform. Remember, second Saturday for most months. Remember, tell everybody that July and August we're going to take off. We're gonna clear our heads for a moment before we come back in September. Remember, caring and sharing. Tell somebody about it. Let's just care and talk about the show, talk about what we're doing here. It's all about our health. Please do not change any aspect of your medical care until you consult your physician. Only your doctor, believe me, only your doctor can best take care of you from a medical standpoint. And if you go on to YouTube, just go onto our website and click our YouTube channel. All of our past webinars are there. Just subscribe so we can continue to to bring those to you. I look forward to seeing everybody in September to come back on as far as the physicians, and I look forward to all the questions that'll come about that webinar as well. All I can say at the end is just spread the word, y'all. Let people know about it. Okay, Kevin, thank you, Dr. Halder. I appreciate you, brother. Keep sending the patients to you because you're doing a good job out there. All righty. And for everything else, until September, I'm going to say peace, and we will see you later. Thank you, everyone. Thank you.
Okay.
All right. Peace now. We'll see you.
Bye now.